which is the bone that's flat between your rib cage. If I wake up and you're touching my boobs, you're going home without teeth, because I was raised in the streets, and that's my instinct, is to hit. So, you may not want to do that with a female. You might want to use between their fingers, get something, a pen, anything, squish right on there. It hurts. On the base of the nail, that little half moon, if you got anything, you can just squish on that too. Feel it. Just put your nail on there a little bit. It hurts. So you don't always have to just rely here, okay? So you got the sternum rub, and I mean rub the skin off. They're dying. We want to make sure they're dying and give the medication to get them up. No answer, I might do the nail or between the fingers. So no response. What would you do? You're home, your kid's not breathing. What's next?
Call 911.
You gotta call for help. So, we teach our folks to not say a word about drugs. What are they presenting? Person's not breathing, not responding. They have just taken priority over every other call from EMS. If you say drugs in Macon County, they're going to send the sheriff's office, and you'll be waiting, and you know what the outcome could be. So, person is not responding and not breathing. Next thing I'm going to do is get my medication ready. So I have it open and ready. I may give them the medication first, but depends how long it's been since they have been breathing. So if I just came on them, I'm probably going to give them a little bit of oxygen. 3 to 5 minutes, the organs start to die. They get compartmentalized in the arms and legs, the limbs die, like we're talking quick. You don't have a lot of time. So this medication is so easy. Watch, this is it, the magic. Woo! So high. That's it. Up the nose, spray it. I'm going to put this on the side of the body that I used, because the next one's going to go on the other side, and I promise you I won't remember, because you're in complete panic. These directions are really simple. This is from Purdue Pharma, Adapt. 1, check if there's a response. Blue around the lips, if it's somebody with darker skin, Native American, or BIPOC, black, indigenous, person of color, BIPOC. They may be gray. They may not be so much blue as somebody with pale skin. I would be probably gray too. Summertime, my motorcycle, anyway. So don't rely on just blue. Lips, nail beds, you know, all these young ladies have fingernails, you can't tell. So, sternum rub in the fingers, in the nail bed. Second, give the Narcan. No rescue breathing here. This is not what we teach. But if you do this, you'll give them a chance to survive. Medication straight up. Remove the spray from the box. Hold it with your thumb in the bottom of the plunger. Do not do that. If you're holding it like this and you spray it a little bit, you've just lost half your dose. Because, and I'll send this around, that's it. Half of that. So you guys can check this out, and I'll pass it around. All right. So, what do we got to do while this medication takes 2 to 3 minutes to work? And look at, we're at 8:20, I'm sorry. What do we do? Gotta have rescue breathing. If you do nothing else but give them oxygen, you'll have maybe saved their life. So first thing I look for is a pen cap in the mouth, a needle cap, excuse me. Because if I pulled the cap off, it's still in there. Because I just told you they drop it in 30 seconds. Fast. Needle's still, the cap's still in there. Get it out, gum, whatever, get it out. We're going to tip the head back. Gently tilt their head back. Do a mouth search. Then I'm going to do a really easy thing called look, listen, and feel. I'm going to put my head down to their nose and mouth, and I'm going to wait to feel air in my face. Listen to sounds of them breathing, and watch to see if the chest is moving. Okay? Look, listen, and feel. No air. They need it. So we're gonna do rescue breathing, 1 breath for every 5 seconds for 2 minutes. That's a long time for me with asthma. I don't know about y'all, but it's a long time for anybody. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000 breaths. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000 breaths. I'm counting because I want to make sure this kid stays alive. 2 minutes, they haven't responded, we give them another dose. Now, most people who die from opioid overdoses are because of lower tolerance. So we just picked up a kid on a warrant, right? Because we went to the house, he overdosed, and there's a warrant, so we arrested him. Now he's in the jail for the weekend, 3 days, Monday, he gets out. His tolerance is already low enough, so when he uses, he overdoses. Highest number of fatalities are from jails, institutions. Yeah, crazy. So, really simple. Sternum rub. Any breathing, nothing happening. Let me give him 1 or 2 breaths just to get some oxygen in the body. Give him the medication, rescue breathing. 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 And in 25 minutes, the ambulance magically arrives.
Stephanie.
Yes, dear.
Does naloxone work on fentanyl overdose?
Yes, naloxone works on any opiate-based drug, period. Doesn't matter. Now, fentanyl is funky because it's, how can I say this quickly? Very short acting. So I gotta use more of it to prevent withdrawal. So I'm using more often. It also has a super high potency, right? So it's 100 times stronger than morphine. That's a potency of 100. So I'm using more often, and I'm using super high potent stuff. Remember what we said earlier? What 2 things affect whether somebody's gonna have an addiction issue?
Frequency.
Quantity and frequency. So fentanyl is a perfect storm. And, as you can tell by the size, where is you?
There.
Right there.
Listen, it ain't gonna take nothing to ship a ton of this.
And it's in everything now,
And
everywhere.
it's in
If you get
most,
heroin, it's in it. If you get Percocets, hand-pressed pills, Percocets on the street.
only if
it's
you get
in
it from the street, right?
From the street.
Yep.
Right, which is,
And we're restricting access to the medication.
Right. several.
So, anyway, all right.
Stephanie, can I
Yes,
just ask you also about this? Because you've got the Narcan that is the the spray.
This is into nasal.
That's the nasal, and I've gotten that in Asheville, but I've only been able to get like the
Oh,
syringe stuff other
you
places,
have
which is
old
so
school
cheap.
naloxone. So,
Right.
that is a
And that's a lot more complicated.
that is a non-FDA approved device.
Okay.
So,
Well,
they-
I did get this from the ER
Yeah.
in Buncombe County, actually.
Yay.
The ER medics gave that.
listen, any naloxone's good naloxone.
Yeah.
The problem with that is that I have to put half of it up one nostril and half of it up the other nostril.
Wait, this is a syringe. They
That's
told
the
me I was
syringe.
gonna.
Oh, it doesn't have a mad device?
No,
Sorry.
it's the syringe, and that scares me, cause like that's easy.
Oh, no, that's
but
easy.
this, I'm like, oh my god,
That's
it's
more
got like 3
effective.
pieces in it.
That's more effective.
Yeah.
So,
Okay.
all naloxone works, some of it works faster. And so I didn't bring any IM kits, well, I lied. We got one. So these are our kits. They're in an amber bag because it doesn't like the sunshine. This medication is literally that much, not a lot. And so you would pop this orange cap off. If you have alcohol and time to search through Dillard's, I guess you can clean this cover, but it's coming off clean. And you're gonna take the needle and you're gonna pull the barrel all the way back. And you're gonna inject all the air inside of this vial. When you let go of it, it's gonna start to pull back and load all by itself. So easy. It's so easy. This, and look it, aren't we good? I'm such a smart butt, I'm sorry. These needles are ginormous. This is a 25 gauge. The smaller the number, the fatter the needle, okay? It's an inch. It has to be put together in the same way. So the back, can I open this?
Mhm.
And I brought you the easy one. So, it's all right. Needle trigger warning. This has to go on here, okay? Gotta put the needle or the syringe onto the barrel. This is a safety piece, so after you use it, you just clip it, throw it on the ground, EMS will pick it up. But just pop it over. Nobody can get stuck here. We never recap a needle. Never, ever. Even if you use it yourself, don't do it. Just put it in your hazmat container. It's not worth the bacteria that is on there from you using it. So pull the barrel all the way back and fill it with air. That was easy, right? This is a short needle. I like to use 1.5" when I buy them. Because then this will go through pants, shirts, it don't matter. Just put it right in the clothes. So, now, you can see through the hole in the side. Watch what happens. See all the bubbles? I'm going to pull the needle down to the bottom because it's all going to fill and do the work for me. That air inside, it's a sealed, and I'm just going to pull it down until every drop is in there. It's done. This air doesn't really matter because we're going to put it in a muscle, but I always push it up. And this literally is straight in, phew, straight out, just like a vaccine. We're going to use this on the back of the arm, my butt. You're going to make a cross, and you're going to use the outside quadrant, okay? Big muscle, and the back of the quad. Back of the arm, butt, or thigh are the 3 places that this can be injected into.
Who has time for all that?
Your kid's not breathing. You got all the time in the
I
world.
mean, so
Well,
is
shit, I mean, you know.
No, I'm just, the nasal just seems so much more effective.
It is, and depending on the condition of their nasal mucus, if they've got a cold and it's thick, it may take longer for it to get through. Everybody thinks Narcan intranasal is so sexy. It's easy. I can do that. This is the fastest and most effective way to administer naloxone, and I encourage every one of you to come to the office and get an intramuscular kit and handle it 100 times. Fill it, put it back. Fill it, put it back. Fill it, put it back. Take it apart. Take it apart. Put it together. Take it apart. Put it together. Get an orange. Shoot it into the orange and feel what that feels like. Refill it with water.
Stephanie, do you know which kind of law enforcement carry?
It depends on the county.
Haywood County?
So Haywood County uses intranasal.
Okay.
One kit is $150. My cost. I mean, my cost is $75. The police departments are going to probably pay $150 for it. So I brought 50
And that's a lot more
kits.
expensive than the other, which is.
Yeah,
the
this
other,
is,
right?
you know, I could put a kit together for $15. So $150 times 50 kits is my donation to Haywood County today.
Don't I remember in one of your other trainings that maybe at our awareness walk where you said that
Sorry.
no, that's okay. that yes, there is a right way to do it.
Of course.
But you are putting it into muscle, so if you make a mistake, you are still yes, okay, that's
You know, if you do nothing, you made a mistake.
Do they ever expire?
Yes. And if yours expires, please bring it to me because I'll give it to somebody who uses drugs. Because the expiration date, there was a big study done. It showed that if the naloxone is kept as it likes to be, 30 years post-expiration was still effective. The efficacy was still there. So it doesn't like heat, doesn't like sun, doesn't like cold. You saw how little that vial is. If that was in your car and it was 30, it would be frozen in, I don't know, 10 minutes. So you go to use it, there's nothing there. In the summer, the car is 100 and whatever, 20, 30, 40 degrees in there. It's evaporated. There's nothing in there. You open the kit, go to use it, it's dead. We also have the Ezio auto injectors at the office. That's a $2,500 unit that walks you through. I typically try to give those to folks who are elderly. So if they have an emergency, it tells them what to do. I've trained a 6-year-old on how to reverse an overdose with their parent.
Wow.
No problem. Easy.
Wow.
You can look on YouTube, there's a video my friend Nigel did with his daughter. It's called Child's Play, and she reverses an overdose with a teddy bear. The kid knows that mom is not okay. Something's wrong. Mom's not answering. So do we wait until she's blue and dead 3 days before the kid can ask for help? The reality is that people use drugs. Well, I don't encourage people to use drugs. We don't sell heroin. Certainly not getting rich. But what we are is saving lives. And if I can teach a kid who has to stay with their grandmother who has cancer and she's on morphine, and grandma took just one extra pill and she don't wake up from lunch. I don't know what to do. She's not answering, Mom. Well, you know where Nana's kid is. Go in the drawer and give her a medication. The ambulance is on the way. 3 minutes. The ambulance can't even get there in 3 minutes. So there's a North Carolina Naloxone Access Law that protects people who distribute naloxone and, well, it gives me permission to distribute it. I'm not a pharmacist. I'm not dispensing. It's been dispensed to me. I'm distributing it with education. And then the law allows you, as a user, to have no liability. You cannot be sued. Nothing. There's nothing anybody can do to you if you try to save their lives with good intention. Good Samaritan Law is pretty comprehensive. You do have to give your name. So this is Stephanie. I'm at Haywood Fitness. There's somebody outside who's not breathing. Can you send an ambulance? I just told them my name and where I'm at. I tell people who use drugs to call, put them in the doorway. 327 right here. He's under the doorway. Come and get him. I'm scared to death. I'm on parole. We actually added to the Good Sam Law a few years ago that people on parole and probation cannot be violated if they call for help for an overdose. Because people, I had a guy who got out of prison, I don't know, however many years he was there, and when he got out, his brother was still using, he had no place to go but home. You gotta give an address, right? So the brother was using, he's like, what do I do? Well, this is a perfect example, because if he calls for help, he's going back to prison to finish his years. When our system is not conducive to helping people stay alive and healthy and for sure not recovering. All right, we looked at this. Intranasal, peel it back, tip up the nose, press the plunger. You're done according to the company that makes it. What to expect? The person could be very agitated. Get off of them. When I wake up, I don't want to be touched. Don't talk to me until I have my coffee. You know, I need my brain to start working. So if I just overdosed and you just gave me medication and you're in my face waiting to see if I'm going to breathe, and I wake up and you're in my face, it's not going to be fun. So back off. Fred, I'm glad you're breathing, man. I had to give you some Narcan. Oh, what? I don't. Thank you. So some of the trap houses, the folks who use will have a pact that nobody tells who eats Narcan. This is a whole different world we're talking about. A whole subculture of folks. So that's what they do to protect themselves. Nobody tell who gave the Narcan. Because somebody's mad because they have no money left and they're sick as a dog. Withdrawal symptoms last 30 to 90 minutes. Repeat doses are necessary. Give it until you don't have it anymore. Every 2 minutes. The combativeness, the vomiting. Okay, about 45% of people who have naloxone administered vomit. So if you've got to leave them for a minute to even call 911, you want them in the rescue position. That way they don't aspirate whatever's coming up. Roll them on their side. Here's the temperature range, 59 to 77. It can have short, when I go out into the field and do street outreach, I'll bring a backpack with naloxone with me. It's 100 degrees outside. It's okay, short. it's not okay to leave it outside for it to be in a
Attention
100.
members, the pool area is now closed.
All right.
Again, the pool area is now closed.
If you're in
and
an
the fitness center will
agency
be
and you're
closing in
using
30 minutes.
naloxone, you wanna make sure that it's within the date. Yep, we're done. People say this to me all the time, naloxone's enabling. Yeah, sure is, I enable life. I enable people to breathe. What they do with it after they breathe is on them. If I have a guy in the corner and he's asking me for $5 and I got, my rule is when I open my wallet, whatever's in there, the lowest bill is what they get. If it's a 20, he's getting a 20. It is what it is. What he does with that 20 is none of my business. That's between me and God. What he does is between him and God. So naloxone prevents death. Dead people don't recover. A lot of questions come around syringe services. We're not a syringe service program. We're authorized by the state to be a syringe service program, but I'm a health hub. That's what I am. Help people stay healthy. We distribute naloxone. We have all kinds of medical supplies, wound care supplies. We offer food, sleeping bags, tents, clothes, whatever. You come, you have a problem, I promise you, you'll leave with at least someplace to get a resource other than me. So we have to dispose of needles that are used. Notice I didn't say dirty needles. Needles aren't dirty, they're used. New ones are sterile. We have to distribute new hypodermic syringes and injection supplies. That means hookers, tourniquets, cotton, Band-Aids, alcohol, you name it. Whatever they're using to inject with, if it's not clean and new, when they touch it after injecting, it probably has hepatitis C on it. Hep C lives in a bottle of water, according to the CDC, for 63 days. 63 days! It's a long time for a virus to be viable to infect your body. So, if we're sharing a spoon and we're both injecting from the spoon, it's brand new. First time we're good. Second time, I've now put my used syringe into that, and the person who uses after me will have whatever I have. And then that person after them, and so on and so on. The hepatitis C numbers are horrific. We have to have security. This is it. I got a lock on the door. We have educational materials galore, access to naloxone, at least to make a referral. Sometimes we don't have any naloxone. And then, depending on what the person presents with, we have to have individual services for them. So if they need, I don't know, birth control, I gotta be able to make a referral for them. I don't do birth control. I don't have enough time to do what we already do. So I make a referral somewhere. But these are required by law with syringe service programs. I'll end with this handsome devil. It's my brother Michael. Michael died, 9 years. He was molested by my cousin when he was 8, a male. I don't know about you, but Roman Catholic families, it's not too nice when you have two men that get together, right? Things are different today. People are who they are, you love who you love, but when you're molesting a child of the same sex, you got a big problem, especially when the church is telling you how bad it is. And so he started drinking when he was a teenager. And then he found cocaine, because it was everywhere when we grew up. I mean, like, you'd be at a pile and there'd be a platter with an ounce of cocaine on it, and it was free. And so people who drink, that use cocaine, there is a scientific neuroconnection to people who use cocaine. Start to drink, and I know alcohol reduces the inhibitions for other things, but this isn't a study that shows causes craving for cocaine. So he decided he was going to go to treatment. My dad drove to Boston to get him, and his girlfriend gave him a Suboxone, and it killed him. So I always end with him because even though I have been doing this work for I don't know how long, whatever, and still do it after him, we still lose the people we love. And we're gonna continue to lose them until we change. We change. He didn't need to change. He used what he needed to wake up in the morning and to face himself in the mirror. Who am I to judge that? Not for me to judge. It was my job to love him. And I used tough love. And I pushed him away. And he died when we were fighting. And so, I am a hard, firm person who is against tough love. I do not believe in it. I don't think it helps us or them. If your kid's doing things to you like stealing, I don't know, I'll come over, maybe I can get something too. Why don't you call the cops? People commit crimes against you, you should call the police and get help, right? Most of our kids aren't stealing from us. Most of them will lie to protect because they're ashamed. So if you can build a relationship with your kid in a way that we know that they're using, and that they can be unjudged and loved, they're gonna be honest. You may not like it. You ain't gonna like what you hear, but they'll be there. And you can maintain the bond, and you can make healthy boundaries for yourself. If I keep my healthy boundary, then the relationship can continue, because you can't have access to my, no, you can't have my bank card. What are you, nuts? I don't give my husband my bank card. Well, that's what I got for you guys. 30 minutes, 40 minutes late. And I'll make sure you get a copy of the slides and a link to the videos so you can see them. But any questions in this last 1 minute? Yeah, Norm.
Just a comment.
Good to see you, by the way. I haven't seen you in a long time.
The study done here in Hayward County by Dr. Teeter
Yeah.
found that the combination of buprenorphine and acetaminophen has more pain-killing power than opiates.
Yuck.
So if somebody has a pain issue, acetaminophen, buprenorphine combination, he even had blister packs made,
So
so you could pop up one of each and, you know.
So the equivalent of what Norm's talking about is 500 milligrams of Tylenol and 200 milligrams of ibuprofen have the chemical equivalency for pain relief of 10 milligrams of morphine. So it works. Tylenol works. And Tylenol and ibuprofen together work even better. So you take them together. So, you guys are awesome. Thank you for putting up with me tonight.
Before y'all leave, I just wanted to add one last thing.
Yeah.
This is why Lisa and I do this. This is Lisa's son, Sam. This is my son, Clay. And this is why we do this, and we are so grateful to Stephanie. And we just wanted everyone, because some folks came in late, there's a resource table at the back of the room. And one of the resources on there, we have a GRASS monthly meeting, which is grief recovery after substance passing. We do it right in this very room. And we also have an ongoing support group for folks that have currently a loved one struggling with substance use disorder. Don't think you have to be a mama to come to our group.
Yep.
We have brothers, sisters, wives. We have one young lady that comes that's in her 20s who lost her husband. It doesn't, just because we're mamas, you don't have to be mamas. So Share Project is our website, shareproject.org. And we are very grateful for all of you to come out, and most grateful to Stephanie. Thank you.
And this is hard stuff. Changing our morals, values, and beliefs to allow people to be who they are despite their risky behaviors is hard stuff. So I'm sure you guys are going home like, that lady is nuts. And that's okay, because something tonight that you heard will help you somewhere in your life. Now, reach out if I can help.